Hello, my name is Jackson and I'll be your nurse today. I've been a nursing student for about 3 years. What I'm going to be doing is I'm going to be doing a full assessment on your infant, and it's going to take about 10 to 15 minutes if that's okay. Okay, so I'm going to go hand wash. I'm going to come back and I want to make sure that I know what patient I am dealing with. So I'm going to identify the patient by their armband, ankle band, and then I'm going to look around the crib as well. There's usually a tag or a name that corresponds with the patient. So after I identify the patient and hand wash, I'm going to go into my assessment. So I want to assess the upper head first. I want to assess the anterior fontanelles. So typically on a patient like this, your anterior fontanelle is going to be present at the age of 18, 18 and below. So I'm going to assess for that. I'm going to feel it shouldn't be firm, it should be squishy, and it should be flat. And then I'm going to assess the patient's anterior fontanelle on the back of the head, and that's usually present between 3 to 6 months below. And it should be about the same, kind of a squishy texture and flat. Next, I'm going to arouse the patient a little bit. I want to make sure that the patient is responding to what I'm doing. So my first reflex is going to be the Morrow reflex, or it's going to be the shock reflex. So I'm going to cross the patient's arm across their chest, and I'm going to hold the back of the head of the patient, and I'm going to drop the patient a little bit and let go of their arms. And what's going to happen with the patient is the patient's arms are going to go out and their legs are going to go out. And that'd be a positive shock reflex of the child. Next, I'd want to do the Babinski reflex, which is the bottom of the foot that we're going to use. And you can use a tool or you can use your finger. And it's a fish hook kind of motion on the back of the foot. And what would happen is you're going to watch a dorsal flexion of the big toe, and then a plantar flexion with the spreading of the other toes on the patient. And that would be a positive Babinski reflex. Next, I want to assess the sucking and the root reflex. Usually you can tell in a patient with a sucking reflex if they have a pacifier, that'd be a positive sucking reflex. I could take the pacifier out and I could rub across their cheeks. What would happen is the patient would turn towards you and have a positive, with their mouth open, with a positive a root reflex they're about to start sucking. So that would be a positive root if you rub something across their face and they turn towards that stimulus with the mouth open. And then my last reflex would be the grasping reflex. So I could use another tool or I could use my finger, and I want to place my finger inside of their hand, and what would happen is they're going to grasp your finger. You can do this with the toes as well, but you can typically get that off the Babinski reflex. So next, I'm going to move my way down to the respiratory. So with the respiratory, I want to listen to the quality of the breaths, respiratory rate, and any abnormal noises within the lungs, so any crackling, any whooshing, anything that should not be there. And I want to listen to the respiratory rate for about a minute. After that, I'm going to move down to the cardiovascular system. I'm going to listen to the heart. I want to listen for any abnormalities, any murmurs, any switchings, arrhythmias, and I'm also going to listen to the heart rate for 1 minute. Along with the cardiovascular system, I want to make sure to assess the pulses. So I want to assess the femoral pulse, and I want to assess the radial or brachial, one of the both. And then also with the pulses, I want to do capillary refill. That can either be, you want to do all of them, fingers, palms, toes, and heels, for less than 3 seconds typically for a capillary refill. After I do the cardiovascular system, I want to go down and assess the skin. So below the diaphragm area, I want to look for any rashes, any redness, any swelling, anything abnormal on the patient, and I want to look through the entire body. I want to make sure to look for birthmarks as well, and I want to identify that. And then possible bruising or anything that shouldn't be there, or something that could identify as violence that could have happened to a child or parent abuse. So after that, also for the head, I want to make sure while I do the anterior and posterior fontanelles, I want to make sure to check the symmetry of the patient's shape of the head, as well as I want to assess the mucous membranes, make sure they're moist and wet, and then any drainage or swelling or anything like that. So least invasive to most invasive. Now I'm going to go into vitals. So first what I want to do is I want to do the pulse ox. So for the pulse ox, I don't see it in here, but typically there are two sensors that'll go around either the big toe or around the foot. You want to make sure those sensors are connected so they're on top of each other, so I can have a positive reading of the pulse ox. Next, I would want to do blood pressure. Blood pressure, you want to do above the heel, above the ankle, and then take my blood pressure like that, around the ankle. Ideally not on the foot that has the band on it, but both of these have bands on them. And I will take my blood pressure. And then next I'd want to take temperature. The temperature, I want to do an auxiliary temperature right above the patient's, right below the patient's armpit. So some takeaways from this: make sure you want to go least invasive to most invasive. Typically with a patient like this, an infant, you want to stimulate the infant before you do any assessments, and you want to let them play. So if you're taking their respiratory rate for a minute, or if you're taking their heart rate for a minute, maybe let them play with the stethoscope a little bit. A big part of infants is it's a new person and it's very scary to them, so make sure you let them play a little bit. Or preschoolers as well. You want to engage a lot with the preschooler because they probably have a lot of questions and they're really scared of you. So engage with the patient, let them play. What else? Pain. During your vitals, you also want to do pain. Your NPAS is typically what you want to do with a patient at this age. So the NPAS, you want to look for crying, any changes in facial expression, discoloration of skin, flailing, anything that could pose as a positive sign for pain. Yeah, other than that, I think that concludes our head-to-toe assessment.